Because you are considering endometrial ablation, we need to first make sure you are completely aware of the risks and benefits of the procedure. These are the required elements for informed consent. Who can benefit from the Novisher procedure? Many women who've had the Novisher endometrial ablation procedure say they are now able to spend more time at work and participate in more social and athletic outings now that they no longer suffer from heavy menstrual bleeding. They also report improved energy levels, better moods, and a boost in self-confidence. Many women had a significant reduction in painful periods and PMS symptoms like irritability. Novisher endometrial ablation is for premenopausal women with heavy periods due to benign causes who are finished childbearing. Pregnancy following the Novisher procedure can be dangerous. Novisher endometrial ablation is not for those who have or suspect uterine cancer, have an active genital, urinary or pelvic infection, or an IUD currently in place. The Novisher procedure is not a sterilization procedure. Rare but serious risks include but are not limited to thermal injury, perforation, and infection. Temporary side effects may include cramping, nausea, vomiting, discharge, and spotting. If you have heavy or long-lasting periods, known as abnormal uterine bleeding, and you don't want to become pregnant in the future, you may be a great candidate for the Novisher procedure. You should talk to your doctor about your heavy periods to determine the best treatment for you. In addition to being finished with childbearing, your doctor will need to rule out any serious causes of heavy menstrual bleeding, like cancer or a pelvic inflammatory infection. It is still possible to conceive after an endometrial ablation procedure. However, pregnancy after endometrial ablation is very dangerous for both the mother and the fetus. Before having a Novisher procedure, you should consult your doctor about using a form of contraception that works for your lifestyle. After endometrial ablation, you may feel some cramping, mild pain or nausea, and in some cases you may experience some vomiting, but for the most part these symptoms are mild and go away within a day. In fact, most women feel back to themselves and back to resuming their normal activities by the following day. Be sure to follow any instructions your doctor gives you no matter how good you're feeling. If you do experience a watery or bloody discharge after having the Novisher procedure, this is normal. It could last for a day or a couple of weeks, even up to 2 months, after having the procedure. It could also come and go, increasing with certain activities. This can be expected after any endometrial ablation procedure. If you do have any concerns, be sure to contact our doctor. Your doctor will explain the benefits and risks of all treatment options you may be considering. Risks associated with the Novisher procedure are very rare, but if you experience any of the following, be sure to talk to your doctor. You should also let him or her know if you have a cardiac pacemaker or any other electrical device in your body before you have the procedure. Here is a list of some of the potential side effects and complications associated with this procedure. A fever higher than 100.4 degrees. Worsening pelvic pain that is not relieved by ibuprofen or other prescribed medicine. Nausea, vomiting, shortness of breath, dizziness. Bowel or bladder problems. A greenish vaginal discharge. Thermal injury. Perforation and infections. When will I know what my periods will be like after the Novisher procedure? Every woman is different, but plan to give your body about 3 months after the Novisher procedure to fully heal on the inside and resume its normal cycle. At that point, you and your doctor should be able to tell what your cycle and periods will be like going forward. Are women satisfied with the Novisher procedure? Yes. In a clinical study, 92.8% of patients reported feeling satisfied with the results 12 months after having the Novisher procedure. In addition, 96.7% said they would recommend the Novisher procedure to a friend.